By the end of the video, you will have learned the most common causes of acute pancreatitis. You will be able to identify the most commonly presented symptoms, and you will feel confident in managing these patients in the A&E or the ward. Acute pancreatitis is an inflammatory process of the pancreas caused by enzyme-mediated autodigestion. In most of the cases, the disease is only mild and resolves spontaneously within a few days. However, severe life-threatening disease can occur in 25% of the patients. The incidence of acute pancreatitis in the United Kingdom has increased over the last 40 years. The actual incidence ranges from 150 to over 400 cases per million population. It shows considerable geographical variation, however, it is one of the most common causes of acute abdomen requiring hospital admission. The pancreas is an organ located in the middle of the abdomen, behind the stomach. It sits on top of major vessels like the aorta, and it's surrounded by the duodenum. The pancreas has two main functions, an exocrine one and an endocrine. The exocrine function plays a major role in the digestion of food by the production of the pancreatic juice. The pancreatic juice is a mixture of water, salts, bicarbonate, and different digestive enzymes. The main enzymes produced by the pancreas are pancreatic amylase, which breaks down large polysaccharides in the food, trypsin, chymotrypsin, and carboxypeptidase, which are protein-digesting enzymes, the pancreatic lipase, which is a lipid-digesting enzyme, and two nucleases, which break down nucleic acids. The endocrine function primarily controls the homeostasis of glucose in the bloodstream by the production of glucagon and insulin, and also regulates the whole digestive function by the production of secretin and CCK. Gallstones and alcohol are the two most common causes for acute pancreatitis. These two account for at least 90% of the cases, with gallstones being the most common cause in the United Kingdom. Apart from gallstones and alcohol, there are several other causes that can lead to acute pancreatitis. As previously stated, pancreatitis is an inflammatory process where the pancreas is autodigested and basically smashed into pieces. This is the easiest mnemonic in order to remember all the causes that can lead to acute pancreatitis. Some of them are idiopathic, gallstones and alcohol, trauma, steroids, malignancy and viral infections like mumps or Coxsackie viruses, autoimmune causes, scorpion stings, hypercalcemia and hypertriglycemia, ERCP and other procedures, and drugs like corticosteroids, thiazide diuretics, and estrogens. Patients most commonly present with epigastric pain that radiates to the back. A lot of patients complain about nausea and vomiting. Tachycardia and fever can also exist, and particularly in cases of gallstones etiology, patients can present yellow or jaundiced. In severe cases, a faint blue discoloration around the umbilicus may be found, known as Cullen's sign, and also a red-purple or green-brown discoloration of the flank, known as Turner's sign. The diagnosis of acute pancreatitis is still relied on clinical diagnosis. Typically, bloods will show increased inflammatory markers, including white blood cells and leukocytosis and C-reactive protein, and also serum amylase and lipase will be typically raised. Imaging is not essential at this stage, however, can be helpful in identifying the cause of the pancreatitis. Initial imaging with an ultrasound scan is essential to diagnose gallstones, and also CT or an MRI is necessary depending on the local guidelines for the diagnosis of necrotizing or severe pancreatitis. Special attention should be given on monitoring the patient. The early warning score can be very helpful in identifying abnormal observations. In addition, daily bloods, including white blood cell count, electrolyte, and kidney function tests, are necessary to assess the progress of the patient. The initial management of acute pancreatitis is conservative. Aggressive fluid resuscitation is necessary and close monitoring of the fluid balance with a urinary catheter. Management of pain is also essential, and also patients should be kept nil by mouth at least in the initial period. In severe cases, ITU should also be contacted to review the patient and take over the care if close monitoring is necessary. In summary, the most common causes of acute pancreatitis are gallstones and alcohol. Typically, patients present with epigastric pain that radiates to the back. Raised serum amylase and lipase are diagnostic. Close monitoring is essential, and management is conservative and consists of fluid resuscitation, analgesia, and nil by mouth. You can test your knowledge by answering the questions found on the comments below. The answers for all the questions are in the description of the video, and also do not forget to leave us feedback again on the comment board. Thank you.